Some important things to consider before hair care are any illnesses, disabilities, and the patient condition. For example, if your patient has a head or neck injury, you might need an order to perform hair care. Here are some supplies you'll need for hair care. These are the specific steps you need to brush hair. Most notable of these steps is to make sure to part the hair in 2 sections, and then part those sections again. You'll have a total of 4 sections to brush through.
Identify the patient using at least 2 identifiers, according to your agency policy. Assess whether the patient has a bleeding tendency. Review their medical history, medications, and laboratory values. Make sure there are no contraindications to the procedure. Perform hand hygiene and apply clean gloves. Place a waterproof pad under the patient's shoulders, neck, and head. Position the patient supine with head and shoulders at the top edge of the bed. Place a shampoo board under the patient's head and a wash basin under the edge of the spout. Be sure that the spout extends beyond the edge of the mattress. Place a rolled towel under the patient's neck and a bath towel over the patient's shoulders. Then brush and comb the patient's hair. Ask the patient to hold a towel or washcloth over their eyes. Test the water temperature. Slowly pour water from the pitcher over the hair until it's completely wet. If the hair contains matted blood, apply hydrogen peroxide to dissolve clots and rinse with saline. Apply a small amount of shampoo. Work up a lather with both hands. Start at the hairline and work towards the back of the neck. Lift the head slightly with one hand to wash the back of the head. Shampoo the sides of the head. Massage the scalp by applying pressure with fingertips. Rinse the hair with water. Make sure that the water drains into the basin. Repeat rinsing until hair is free of soap. If you need to refill the pitcher, raise the side rail when leaving bedside. Apply conditioner or cream rinse if requested, and rinse the hair thoroughly. Wrap the patient's head in a bath towel. Dry the face with the cloth used to protect their eyes. Dry off any moisture along neck or shoulders. Dry the patient's hair and scalp. Use a second towel if the first one becomes saturated. Comb hair to remove any tangles and use a dryer if desired. Remove the towels underneath the patient. Put away any materials used. Make sure you discard any soiled linen in a dirty laundry bag. Remove and dispose of gloves. Perform hand hygiene. Help the patient to a comfortable position and raise the side rails if appropriate. Lower the bed to the lowest position. Make sure you place the nurse call system in an accessible location within the patient's reach. Inspect the condition of hair and scalp after completed. Ask the patient whether she feels clean and comfortable. Record or report any lesions or persistence of lice to the healthcare provider.
Here are a few things to know before shaving. It's important to make sure to determine what kind of razor to use, electric or straight. Don't use a straight razor for anyone at risk for bleeding tendencies. Here's some supplies you need for shaving.
Walk in and identify the patient using at least 2 patient identifiers. Assess whether the patient has a bleeding tendency by reviewing medical history, medications, and laboratory values. Review medical records to determine that there are no contraindications to the procedure and determine whether or not a straight razor or an electric razor is more appropriate. Perform hand hygiene and apply gloves. Then you will place the bath towel over the patient's chest and shoulders. Run warm wash water in the basin and check water temperature. Place washcloth in the basin and wring out thoroughly. Apply cloth over the patient's entire face for several seconds. Apply approximately a 1/4 inch of shaving cream or soap to the patient's face. Smooth the cream evenly over the sides of face, on the chin, and under the nose. Hold razor in the dominant hand at a 45-degree angle to the patient's skin. Begin by shaving across one side of the patient's face using short, firm strokes in direction that the hair grows. Use the non-dominant hand to gently pull the skin taut while shaving. Ask the patient whether they feel comfortable. Dip the razor blade in water because shaving cream can accumulate on the edge of the blade. After all facial hair is shaved, rinse the face thoroughly with warm, moistened washcloth, and then dry the face thoroughly and apply aftershave lotion if desired. Discard of soiled linen in a dirty laundry bag. Remove and dispose of gloves and perform hand hygiene. Help the patient to a comfortable position and raise side rails if it's appropriate, and lower bed to the lowest position. Place the nurse call system in an accessible location within the patient's reach. Inspect the condition of the shaved area and the skin underneath. Look for areas of localized bleedings from cuts and areas of dryness. Ask the patients whether they feel clean and comfortable, and then leave the room. Walk in.
Hair care is important not only because hair can indicate health, but also because it can affect the patient's feeling of well-being and their body image.
Hygiene skills can be delegated to assistive personnel with proper nursing instruction.
Here are some things to know about foot and nail care. It's important to note that you might need an order to trim nails because the risk of accidentally cutting skin around a nail might predispose your patient to infection. Here are some supplies for nail care.
Identify your patient using at least 2 identifiers. Review the patient's record, including healthcare provider's orders, nurse's orders, and verify the healthcare provider's order for cutting nails. Make sure to check your agency policy. Review any medical record for foot or nail problems. After assessing your patient, assist into a seated position if they're ambulatory, or help a bedbound patient to a supine position with the head of bed elevated. Place a disposable bath mat or towel on the floor underneath patient's feet, or place towel on bed. Fill your wash basin with warm water. Place basin on floor and lower side rail, or place basin on waterproof pad on the mattress. Assist patient to immerse feet. Adjust the over bed table to a low position and place it over your patient's lap. Instruct the patient to place fingernails in emesis basin and arms in a comfortable position. Allow the patient's feet and fingernails to soak for 10 to 20 minutes. Rewarm the water after about 10 minutes. Important, if the patient is diabetic or has peripheral vascular disease, skip this step. Perform hand hygiene and apply clean gloves. Clean gently under the nails with a plastic applicator stick or soft brush while immersing the fingers. Use a soft cuticle brush or nail brush to clean around the cuticles to decrease overgrowth. Remove hands from the basin and dry thoroughly. File the fingernails straight across and even with the tops of fingers. Only use nail clippers if permitted by agency policy. If permitted by agency policy, clip fingernails straight across and even with the fingers, and smooth the nail using a file. Apply lotion to the patient hand. Move over bed table away from patient. Perform hand hygiene and apply clean gloves. Begin foot care by scrubbing the calloused areas of feet with a washcloth. Also make sure to clean between the toes with a washcloth. Remove feet from the wash basin and dry feet thoroughly and clean under nails. Clean under the nails similarly to as you would with the hand. Gently clean under the nails with a plastic applicator stick or soft brush. Use the soft cuticle brush or nail brush to clean around the cuticles and decrease overgrowth. Only trim toenails if your agency policy allows. Trim toenails straight across and gently smooth any sharp edges with a nail file. Do not file any corners of toenails. After filing is complete, apply lotion to the feet. Rub in thoroughly. Do not leave any excess lotion between the toes. Help the patient to a comfortable position in the bed or chair after removing towel underneath the feet. Make sure to place the nurse call system in an accessible location within the patient's reach. Raise any side rails as appropriate and lower the bed to the lowest position. Sanitize equipment according to the agency policy. Make sure to dispose of any used equipment like emery boards and dispose of gloves and perform hand hygiene. Inspect the nails and cuticles around fingers and toes. Make sure to ask the patient whether there's any pain or discomfort. Apply hand hygiene before leaving the room.
It's important to know that conditions of the patient's feet and nails is key for their mobility to perform activities of daily living and their overall health.
Using assessment considerations and clinical judgment, safety concerns can be considered with hair, shaving, foot, and nail care, such as environmental safety factors, special safety precautions, and then pre-existing conditions such as diabetes mellitus or peripheral vascular disease. These hygiene skills play a huge role in the care that nurses provide. Patients under nursing care around hygiene, when performed safely, effectively, and compassionately, improves patient satisfaction, health outcomes, reduced costs, and better adherence to care plans. Hygiene skills can be used to assess health promotion practices, emotional status, healthcare and educational needs, and educational interventions. Some general assessments that can be ascertained during hygiene include mental and emotional, pain, neurological, extremity, and integumentary. Please review the following focus assessments on the skin and explore these focused assessments on the hair and scalp. Also note the focus assessment on the nails. Nurses need to ensure they provide patient-centered specific education about their unique hygiene needs. The best technique to do so would be utilizing the teach-back method, followed with observing the patient performing that assessment on themselves and then describing what they see in order to ensure that the teach-back method was successful, or if further re-education is needed.